Okay, so our next unit is History and Trends in Medicine. And we'll talk about the different time periods, starting way back in the primitive times and how medicine, how people were treated for illnesses. So our first time period is primitive times. They believed that illnesses and diseases were punishment from gods. So they thought that if you were sick or suffering, it was because you had done something wrong and you were being punished. And the physicians in the primitive times were witch doctors who treated illnesses. And the way they treated illnesses were with ceremonies. Also, in the primitive times, to treat illnesses, they used herbs and plants. So back then, they didn't have pills, medicine, IVs, or injections. They used plants. So you would either chew up the plants, rub the plants on you, or something like that to help with the sickness. One thing in the primitive times that they did was called trepanation. This was one of the first surgeries because they believed that the reason why you were sick was because you were being punished. You had demons inside you. So they would cut a hole in the skull of someone to release those demons. So you can see this is a real skull of somebody who actually had trepanation. And we will actually watch a video today or tomorrow of someone having a trepanation. And we'll talk about what might be the complications of trepanation. Okay, the Egyptians. Egyptians were the first ones to keep accurate health records. The physicians were priests. They used temples, their places of worship as their medical schools and their hospitals. When you think of Egyptians, you think about mummies. And so they were the first ones to do embalming. When someone dies, the body has to be embalmed so that it does not rot or decay. And the Egyptians were the first ones that did this. By embalming, they could learn more about the anatomy of the body and the diseases. The embalming was done by a special priest. It wasn't done by a doctor. And then after they embalmed the person, they used gauze, a wrap that was similar to gauze, to wrap the bodies up. And then that's where mummies came from. They also use strong antiseptics. If you've ever dissected a frog or something like that, they usually have it in a liquid so that in that you can smell. It usually has a really strong smell. This is what they use to keep the body from rotting or decaying. Egyptians also used leeches, which are kind of nasty, but they would actually put these on put them on humans. If you had a bad infection, they could put the leeches on you. The leeches would actually suck out the bacteria that was causing the infections. You didn't feel it because the saliva or spit from the leeches is a natural anesthetic, which would numb it, so you don't feel them sucking on you. And this is something that is still done today. It's approved by the Food and Drug Administration as an approved medical treatment. And we'll watch a video about this also of someone having leeches used on them to help with a skin disease that they have. Then we have the ancient Chinese. The ancient Chinese are more about treating your body and your spirit, not so much on taking lots of medication. They're more about herbal treatments, things like acupuncture. You've probably heard of acupuncture, where they stick the little needles in your body to help with pain or different diseases. And we'll also watch a little video on that too, showing more about acupuncture. They also recorded a pharmacopoeia of medications. So if you think about what a pharmacy carries, which is medications, the ancient Chinese were ones that started recording what they used to treat things. Then you have the Greeks. The Greeks started making observations about the human body and the effects that disease have on the human body, which led to more modern medicine. Now we could say, okay, this disease has this effect on the body, so they could learn how to treat it better or cure it. And the Greeks also believed that illnesses were a result of natural causes. That's more similar to what we believe these days, not that diseases were caused by demons or something that you did wrong, that it's a natural cause. The Greeks also used massage and art therapy and herbal treatments. And they also discovered that your diet and being clean could help prevent disease. Everyone knows that, sickness and stuff is spread through being dirty, not washing your hands. And a way to stay healthy is to stay clean and to eat a good diet. The Romans. The Romans were the first to build sanitation systems and sewers. So you can think about how nasty things were before, like sanitation systems and sewers, because where did that stuff go if you didn't have a sanitation system? The Romans also treated disease with diet, exercise, and medication, and that's more like we do now. If you go to the doctor and you're sick, most of the time, a lot of diseases are caused by being obese. So they tell you to lose weight, exercise. You can take different medications for illnesses. And the Romans also, the doctors cared for the soldiers in their houses. So these became the first hospitals in the Roman times. The Dark Ages. The Dark Ages, and you'll probably learned about this in history, began after the fall of the Roman Empire. So now, where they had gone all the way from primitive times to ancient Romans, they were studying medicine. Now in the Dark Ages, it was not allowed to study medicine anymore. They basically just prayed for people. If you got sick, you got prayed for. You didn't get treated. And the monks and the priests were the ones who treated patients with prayer. So then the Middle Ages, after the Dark Ages, a lot of people died from the bubonic plague, or it was also called the Black Death. It killed 75% of the population in Europe. So now there was a renewed interest in medical practices because so many people were dying. So people became more interested in studying medicine again. So now medical universities were created. Also in the Middle Ages, the Arab physicians used chemistry to advance pharmacology. Pharmacology, if you think about pharmacies, you get medicine from pharmacies. So in the Middle Ages, they started developing more advanced medicines. They also required physicians to pass exams and obtain licenses. When you go to get your driver's license, you don't just turn 16 and go get a driver's license. You have to take a test and you have to get your license. It's the same with physicians and a lot of other medical careers. Once you finish college for that particular career, you don't just go start being a doctor. You have to actually go take a test and get a license. So now we're into the Renaissance times, and during the Renaissance times, they started dissecting the bodies. So by being able to dissect the bodies when people died, they could understand the anatomy of the bodies better, and they could share more information about the effects of diseases on the bodies, because during the Renaissance times, the printing press was invented. So by having the printing press, they could write down things and copy it and share it with other people of things that they found out about the anatomy and diseases of the body. All right, 16th, 17th, and 18th centuries. During these centuries, the cause of this disease was still not known, and many people were still dying from infection. So the invention of the microscope helped that, because now doctors could see the really small organisms that were causing diseases, and they could see that better, and that would help them find out how to treat the diseases. Also, during the 16th, 17th, 18th centuries, they had what were called apothecaries, and this led to the development of pharmacies. So apothecaries were the places you went to get your medicines and prescriptions, and that's what pharmacies are now. So if you look over at this picture, you'll see one of our abbreviations we just learned. So I want you to write to the side of your notes what this RX means. Everybody should know that. Should be a pretty easy one. And I just said it a minute ago. So write that to the side of your notes, because I'll be checking these notes. And this will help me see that you were actually paying attention to what I'm saying. Okay, so now some more about the 16th, 17th, and 18th centuries. There's a man named Edward Jenner, and he developed the first vaccination to prevent the spread of smallpox. We'll also watch a little video on Edward Jenner and talk more about him later in the unit. But everyone in here's had a vaccination. You had to have certain vaccinations before you started public school. So, like your chickenpox vaccine or your mumps vaccine. So everyone's had a vaccination. All right, 19th century. So prior to the 19th century, nurses were basically just trained at the bedside. There was no formal training. But during the 19th century, Florence Nightingale developed formal training for nurses. Infection control methods were also developed during the 19th century. Because microorganisms are so small, they had to have ways to prevent infection. So if you think about all of the germs that are on your hand, you cannot physically see them. You might could see them with a microscope. So we have things now like hand sanitizer that help prevent infection from being spread. And then viruses were also discovered in the 19th century.